Vitamin A enables your retina to convert light into electrical signals your brain interprets as vision. It regulates gene expression that tells skin cells to mature and replace themselves properly. It activates immune cells so they recognize and attack pathogens. Your eyes are the first system affected by vitamin A deficiency. Night blindness occurs when the retina cannot regenerate rhodopsin, the light-sensitive pigment. From there, the cornea dries out and softens, a condition called xerophthalmia. If untreated, it progresses to corneal ulcers and blindness. Vitamin A also regulates immune function. Deficient children die from measles and diarrhea at significantly higher rates. The solution is dietary. Liver, yes, liver, eggs, dairy, orange vegetables, and leafy greens. Plant sources provide beta-carotene, which converts to retinol slowly. Animal sources provide preformed retinol, which the body uses immediately. Excess supplementation is dangerous because vitamin A accumulates in liver tissue and becomes toxic. Pregnant women should avoid high-dose supplements due to risk of birth defects. Vitamin B1 helps convert carbohydrates into energy by acting as a coenzyme in multiple metabolic pathways. It maintains the myelin sheath around nerves, allowing electrical signals to travel quickly. It supports heart muscle function and neurotransmitter production. B1 deficiency causes beriberi, a disease characterized by peripheral neuropathy, muscle wasting, and heart failure. The name comes from a Sinhalese phrase meaning weakness. Two forms exist. Wet beriberi affects the cardiovascular system with edema and rapid heartbeat. Dry beriberi affects the nervous system with nerve degeneration and muscle atrophy. In alcoholics, B1 deficiency produces Wernicke-Korsakoff syndrome. This includes confusion, ataxia, eye movement abnormalities, and severe memory impairment. Treatment is intravenous B1. Prevention requires adequate intake from pork, fish, legumes, and whole grains. Polished rice lacks B1 because milling removes the husk where the vitamin is concentrated. Vitamin B2 is a precursor to two coenzymes, FMN and FAD, which are required for energy production, fatty acid oxidation, and the electron transport chain. It helps recycle glutathione, the body's primary antioxidant. It supports red blood cell production and maintains mucous membranes. Without B2, energy metabolism slows, causing fatigue. Mucous membranes crack and swell, producing cheilosis and glossitis. The tongue becomes magenta-colored and painful. The eyes become light-sensitive. These symptoms overlap with many other conditions, so deficiency is frequently missed. The gut absorbs B2 in limited amounts, so large doses simply produce neon yellow urine. B2 is destroyed by light, which is why milk in clear glass bottles loses significant content. Paper cartons protect it. Dietary sources include milk, eggs, almonds, and mushrooms. Vitamin B3 forms the core of NAD and NADP, coenzymes involved in over 400 biochemical reactions, including DNA repair, cell signaling, and energy production. It helps lower LDL cholesterol and triglycerides when taken pharmaceutically. It supports skin barrier function and digestive tract health. Without B3, pellagra develops. Pellagra is the disease of B3 deficiency. Its three primary symptoms are dermatitis, diarrhea, and dementia. The skin develops rough, scaly lesions in sun-exposed areas. The digestive system fails, causing vomiting and diarrhea. Neurological symptoms progress from confusion to psychosis. In the early 1900s, pellagra killed approximately 100,000 Americans, primarily in the South, where diets consisted almost entirely of corn. Corn contains vitamin B3, but it is chemically bound and cannot be absorbed unless treated with alkali. Indigenous populations knew to treat corn with lime water. European settlers did not. Today, vitamin B3 is used pharmaceutically to treat high cholesterol. Dietary sources include meat, fish, poultry, peanuts, fortified grains. Vitamin B5, also known as pantothenic acid, helps produce steroid hormones, including stress hormones from the adrenal glands. It supports antibody production and wound healing. It is virtually impossible to develop a vitamin B5 deficiency through diet alone, as the vitamin is present in nearly all foods: meat, vegetables, grains, eggs. Vitamin B6 is a coenzyme for over 100 enzymatic reactions, including neurotransmitter synthesis, hemoglobin production, and homocysteine metabolism. It helps convert tryptophan to vitamin B3 and supports immune function. It regulates mood by enabling serotonin and dopamine production. B6 deficiency causes a specific form of microcytic anemia. It also processes homocysteine. Elevated homocysteine damages blood vessels and increases cardiovascular disease risk. Oral contraceptives lower B6 levels. Chronic toxicity from megadoses causes peripheral neuropathy with numbness and instability. Dietary sources include chickpeas, poultry, potatoes, and bananas. Vitamin B7, also known as biotin, helps regulate gene expression and supports the maturation of hair follicles and nail beds. It also plays an important role in maintaining the nervous system. Biotin deficiency can cause thinning hair, brittle nails, and a scaly red rash around the eyes, nose, and mouth. Neurological symptoms may include include lethargy, hallucinations, and peripheral numbness. Raw egg whites contain avidin, a protein that binds to biotin and reduces its absorption. True biotin deficiency is rare and is usually associated with genetic disorders or prolonged consumption of raw egg whites. Most people can obtain enough biotin through foods such as eggs, nuts, salmon, and sweet potatoes. A common myth is that taking extra biotin will automatically lead to faster hair growth and stronger nails. While biotin supplements are heavily promoted by influencers and beauty brands, they are unlikely to provide noticeable benefits unless a person is actually deficient. Vitamin B9, also known as folate, is required for DNA synthesis and cell division. During the first month of pregnancy, before most women know they are pregnant, the fetal neural tube closes. Folate deficiency during this period causes neural tube defects, including spina bifida and anencephaly. These conditions are preventable. Flour fortification with folic acid has reduced neural tube defect rates by approximately 50% in countries that mandate it. Folate deficiency also causes megaloblastic anemia, where red blood cells enlarge but cannot divide properly. Dietary sources include leafy greens, legumes, fortified grains, oranges. Vitamin B12 maintains the myelin sheath that insulates nerves, allowing rapid signal transmission. It works with folate to synthesize DNA and produce red blood cells. It helps convert homocysteine to methionine, protecting blood vessel. No plant produces vitamin B12. B12 is synthesized by bacteria found in soil and animal digestive tracts. Dietary sources are exclusively animal products: meat, fish, eggs, dairy. Vegans develop deficiency after their body stores deplete, which takes 3 to 5 years. Deficiency causes memory impairment that mimics dementia, psychosis, and paralysis. Pernicious anemia is an autoimmune condition where the stomach cannot absorb B12. These patients require lifelong injections. Oral supplements can reverse diet-related deficiency. Vitamin C is required for collagen synthesis, which provides structure to skin, blood vessels, tendons, ligaments, and bone. It acts as an antioxidant, neutralizing free radicals and regenerating vitamin E. It enhances iron absorption from plant foods. It supports immune cell function and helps clear damaged cells. Without vitamin C, collagen production stops. Blood vessels weaken, causing easy bruising and bleeding gums. Wounds do not heal. Old scars reopen. Hair grows in corkscrew shapes. Dietary sources include citrus fruits, bell peppers, strawberries, broccoli. Vitamin D is not a vitamin. It is a hormone synthesized in the skin upon exposure to ultraviolet B radiation from sunlight. Latitude significantly affects synthesis. At latitudes above approximately 37 degrees, no UVB reaches the ground during winter months. Dark skin requires 3 to 5 times longer sun exposure than light skin to produce equivalent vitamin D. Sunscreen blocks production. Vitamin D regulates calcium and phosphorus absorption from the intestine. It directs calcium into bone tissue for mineralization. It modulates immune cell activity, reducing inflammation. It influences muscle function and cell growth regulation. Without vitamin D, calcium cannot be absorbed efficiently. The body pulls calcium from bones, weakening them. Children develop rickets with bowed legs and soft skulls. Adults develop osteomalacia with bone pain and muscle weakness. Immune function suffers, increasing infection risk. Mood regulation is impaired, with higher rates of depression. However, vitamin D does not work alone. But this is the part doctors often don't tell you. Vitamin D should not be taken in isolation. As calcium absorption increases, vitamin K2 becomes essential to help direct that calcium into the bones rather than the wrong tissues. This is why vitamin K2 should be taken with vitamin D. Its role will be explained later. Sources include sunlight, fatty fish, egg yolks, fortified milk. Vitamin E acts as a fat-soluble antioxidant that protects cell membranes from oxidative damage. It prevents lipid peroxidation, where free radicals attack fatty acids in cell walls. It supports immune cell function and helps blood vessels widen to prevent clotting. True vitamin E deficiency is rare but severe. It causes peripheral neuropathy that begins in the spine and progresses outward. Symptoms include loss of coordination, muscle weakness, and visual deterioration. Deficiency occurs primarily in people who cannot absorb fat because vitamin E is fat soluble. This includes patients with cystic fibrosis, liver disease, and short bowel syndrome. Dietary sources include nuts, seeds, and vegetable oils. Vitamin K. 2 forms of vitamin K exist. K1 is found in plants. K2 is found in animal products and fermented foods. Vitamin K1 is required for blood clotting. It activates proteins that allow coagulation to occur. Newborns receive a vitamin K injection at birth because they have extremely low stores and are at risk for fatal brain bleeds. Vitamin K2 directs calcium into bone and teeth while preventing calcium deposition in arteries. Vitamin K1 deficiency causes easy bleeding and bruising, and K2 deficiency causes osteoporosis with vascular calcification, as calcium is not properly directed into bones. Therefore, it is important to take vitamin K2 together with vitamin D to help ensure calcium is used appropriately in the body. Natto, a fermented soybean dish from Japan, contains the highest known concentration of K2. Other sources include liver, cheese, egg yolks, and dark leafy greens. Long-term antibiotic use can reduce K production by gut bacteria. That's all for today. I'll be making more videos like this, so subscribe if you'd like to see the next one.